when we report data, we've got to really look at the information that the public is really asking. So we want to simplify this in January. You would see that there is a difference between number of tests run and number of persons tested. So the number of tests run does not necessarily mean that that's equivalent to the number of persons tested. A person may have been re-swabbed, they may have gotten a third swab. It may have been a negative from a rapid test and now they've gone on to do a PCR. So that number will not equal, so it's not 2 over 10 is 5. It won't equal that. You'd have to look at the number of persons tested as the denominator and the positive rate as and the number of positive tests as the numerator. And that would give us the positivity rate. So we are looking at simplifying that data and ensuring that when the general public looks at it, they can definitely say, okay, these numbers are matching. I wanted to take this opportunity to clarify as well with regards to the clinically recovered cases, because I know that this has been a question from many people, and I always see it being asked. There are 2 different ways that a country can actually say if somebody has recovered or clinically or laboratory. Now we do know from evidence, from guidance from CDC, WHO, the EU, that after 9 or 10 days, you are unlikely to be infectious. Now I really want to make the clarification with the clinically recovered cases, because what we have decided at the Ministry of Health is that we had implemented, and I sent out a memo to the regional management team, not to the general public on a whole, to say that at this point, persons can be deemed clinically recovered if, and I had jotted down 3 or 4 different criteria that they have to meet. So I wanted to make it clear that it's not that, okay, today I'm day 14, I am clinically recovered. You don't determine that on your own, nor does your employer. It should be somebody from the Ministry of Health or a doctor, nurse in the private sector who has been guided by what is determined as clinically recovered.